Hello, everybody. My name is Tanner Lapointe, and I am a program facilitator with the Schizophrenia Society of New Brunswick. Today, we're going to be talking about obsessive compulsive disorder, often referred to as OCD. So, what exactly is OCD? So, obsessive compulsive disorder is a medical condition in which the individual experiences chronic, intrusive thoughts and the urge to do something repetitively. And OCD is vastly different from having normal habits and routines. So what are the symptoms of OCD? So there are intrusive thoughts and images. This is when the individual experiences unpleasant and uncontrollable thoughts. These thoughts are often very explicit and may be sexual or may be violent. They may continuously have thoughts about them harming other people. This does not make the individual a bad person or a violent person. Most people with OCD have absolutely no desire to act on these intrusive, violent thoughts. They just can't control having the thoughts. Fear of being contaminated by germs. Fear of harming yourself or others. And an excessive focus on an idea such as religion. They may cling to a certain topic and spend an excessive amount of time on it. And having the urge to do things repetitively. So for example, they may turn on and off the lights 5 times before going to bed. Or if any of you have ever seen the TV show The Big Bang Theory, when Sheldon Cooper has to knock on a door 3 times before entering. They might have to check the stove 20 times before going to bed. So they have to do things repetitively, and they feel if they don't do that, something bad will happen. So what exactly causes OCD? So we have a genetic predisposition, which is a family history. So if somebody in my family has obsessive compulsive disorder, I am at a greater risk for developing the disorder. People with OCD also have clear differences in brain structure. And being predisposed to trauma and abuse can be a precursor in developing OCD. So what are some of the treatment modalities for obsessive compulsive disorder? It is a very treatable disorder. So some treatment modalities include psychotherapy and cognitive behavioral therapy. Medications such as selective serotonin reuptake inhibitors, these drugs work by increasing the levels of serotonin in the brain. In some severe cases, antipsychotic medications such as risperidone or quetiapine may be used to alleviate some of the symptoms. In some other severe cases where the individual does not respond to psychotherapy or medications, they may use other methods such as transcranial magnetic stimulation. This is when the individual's brain is stimulated with mild magnetic currents that stimulate brain cells in the area of the brain that regulates mood. We also have electroconvulsive therapy, or ECT. With electroconvulsive therapy, the individual is put to sleep via an anesthetic and their brain is stimulated with electrical currents. The biggest difference between ECT and transcranial magnetic stimulation is the individual does not have to be sedated for transcranial magnetic stimulation, and it is often done on an outpatient basis. So I would like to thank you all for taking the time to watch this video today. I hope you found it very helpful and informative. For your benefit, in the description, I've included some contact numbers if you're seeking help. Please remember, however, if you are in crisis, call 911 or proceed to your nearest emergency department as soon as possible. I have also included links to various websites if you're seeking for more information about these topics. I would also like to thank Dr. Khan for taking the time to review our videos. It is very much appreciated. Thank you, everybody.